Hey guys, welcome back to the channel. Today I want to talk about a modality that we commonly use in the clinic and something that I often give my patients for a home program for them to complete at home as well. The modality that we are talking about today is a form of cryotherapy or cold therapy. It's called ice massage and you are going to love it. Let's go ahead and get into the video. So first, I think it's important that we talk about why we would use cryotherapy in a therapeutic way. So first things first, we know that cold therapy or using ice or cold modalities is going to help reduce the rate of edema. So it's causing vasoconstriction, which means that the blood vessels are getting smaller, so they're not letting as much blood into the interstitial tissues. And it's also going to slow down the metabolism of the cells in that area, in the affected area that you're applying that cold modality over. So that's going to cause the body to reduce the rate of swelling in that area. When you apply it for very short periods of time, like 5 minutes or less, you can actually help to facilitate muscle activity. And so you can get those alpha motor neurons turned on and create increased facilitation of the muscle. It's also helpful in reducing spasticity in certain muscle groups or tendons, so it slows those Golgi tendon organs. There we go, GTI. I could remember the acronym and I couldn't remember the actual words for a minute there, but it's going to kind of turn all those systems off or decrease the rate of them, so it's going to help control spasticity or muscle spasms. But I also think it's really important to note that while used in a therapeutic way, cold therapy is going to vasoconstrict, right? Those blood vessels are getting smaller. But if you use it for too long of a period of time, or you allow the tissues to get too cold, we actually go into vasodilation, meaning that the blood vessels are going to increase in size. So what happens is if we have the cold on there for too long, or the tissues get too cold of a temperature, they drop too low, the body actually gets this signal that tissue damage is occurring, and so it's going to vasodilate those blood vessels so that it can flood the area with blood to warm the tissues back up. So it's really, really important that when you're applying ice or cold therapy that you do not do it for too long, because it can cause tissue damage and actually cancel out the effect that you were trying to get from it, okay? So that's a really important point. So remember, too long, too cold is not a good thing. Okay, so of all the types of cryotherapy or cold therapy, why would we use ice massage versus a cold pack or an ice pack? So the easiest way that I can explain it is that ice massage is more intense. Ice massage is going to absorb more of the energy from the tissues than a cold pack, so it's going to be a little bit more effective, and it is a little bit more aggressive of a treatment too, so you also have to be careful and listen to what the person is telling you. Some people might tolerate a cold pack or an ice pack a lot better than they tolerate ice massage. So ice massage is a little bit more intense, a little bit more effective, and you can really help decrease inflammation of a tendon this way. Now, a couple of things to remember before using ice massage on a patient or on yourself. You want to make sure that you are watching out for people who are cold intolerant or cold hypersensitive. So cold intolerance is something that some people really do have. It's almost like you can think of it as an allergy to cold. And sometimes it happens after an injury too, especially if nerves were damaged. It can last 2 years or more sometimes, where that person will actually be intolerant to the cold treatment. So what you're looking for is, while you're doing that ice massage, if the person is telling you that they are feeling itching, they're really uncomfortable, almost like sick to their stomach kind of feeling, they might be cold sensitive or cold hypersensitive, and you should watch out for that and listen to what the patient's telling you, right? And you might want to remove that modality at that time. If you notice that after the ice massage has been completed, if your patient has almost like a welt, right? Like a raised red area, it looks like hives, that is a sign of cold intolerance. And for a patient that shows that response, I probably would discontinue all cold modalities for that person for the time being, because that means that their body is rejecting that treatment. It's not going to be good for them or helpful for them. And of course, we don't want to cause harm. Also, when you're thinking about performing ice massage for a patient, you should keep in mind any cardiovascular issues that person might have, including peripheral vascular diseases, and also people with Raynaud's, right? So those people are probably not going to do great with cold treatments. So just watch out for those things. If somebody has, obviously open wounds, be careful in that area, or proceed with caution, and just make sure that your patient is going to be okay with that. I would also probably be cautious when starting to perform cryotherapy or ice massage, as you should with any modality, right? People who are cognitively limited in some way, or that there is a language barrier. So the person that's receiving the modality, the treatment, needs to be able to understand what is being done to them, what they should be feeling, and what to, when to tell you to stop. Obviously for safety reasons, right? So you want to make sure that there are no cognitive limitations, and that person can communicate their well-being with you, okay? So we've talked a lot about cold therapy, about contraindications and precautions for ice massage, but we haven't even talked about what ice massage is yet. So ice massage literally means applying the ice directly to the skin. So it is going to be a very intense feeling, and it really helps to decrease inflammation locally in a certain spot. So a few diagnoses that I often use ice massage for include lateral epicondylitis or tennis elbow. I use it a lot for people with trigger finger, that flexor tenosynovitis, where they've got those little nodules in the area of the A1 pulley, right, in the palm of the hand. I use it a lot for ulnar wrist pain as well. I've just had some good success with that. Some people not as much, right? They're a little bit more sensitive, but sometimes after I get them like stretched out a little bit, I'll sometimes do a little ice massage, whether they have ulnar abutment or impaction, or sometimes like ECU, tenosynovitis or tendonitis. And then I actually like to use it for some people with Decker veins or mommy wrist as well. You do have to be a little bit careful with that sensory branch of the radial nerve in that area, right? Sometimes that's a little bit sensitive for some people, and it doesn't feel so good for them. It makes the nerve a little bit angry, but I do like to use it for that sometimes. And of course, there are probably thousands of other applications. And if you guys actually have any patients or diagnoses that you have found ice massage really works for them, like let me know in the comments. I would love to hear your feedback on that, and what types of diagnoses that you've used ice massage for successfully, or things that you have used and it hasn't worked so well for you. Leave that below. Okay, so for recommending patients to use ice massage at home, I always recommend they get some little Dixie cups, right, from the store. The type that I have is the waxy kind, which kind of sucks. It's not as easy to use. So if you can recommend the paper ones for them, that's actually better. So you just freeze a little bit of water, right, in the Dixie cup, and then when you're ready to do your ice massage, you just have to, oh my gosh, I can't even get it. Okay, sorry guys, I couldn't get it with my hand because I have weak pinch, but you just are gonna peel that back, right? Again, that's why the paper cups are way better than the waxy ones. So you just peel back enough to expose the ice on top, and make sure that you have towels next to you because you will probably get a little bit wet with that. So that's what it will look like, right? So you've got your ice exposed on top. That way you can just apply to the area when you're ready. And with ice massage, you always want to instruct them to use moderate to firm pressure based on their tolerance. And then you always want to do kind of transverse strokes, right? So if the tendon is running up this direction, you want to go perpendicular to that, right? Just like that, firm pressure. And with ice massage, before I touch that ice to the patient, I want to make sure I've done my job educating them. I want them to know why we're doing this treatment. what they can expect to feel, and I want to tell them that they need to let me know if they are having itching or if this treatment is not tolerable and they need me to remove the ice from their skin. So I want them to know that I'm respecting them and their pain and what they're feeling as well, and that communication is really important. I think that what I always tell my patients too, let me say it this way, I always tell them that it's going to sting. It's that ice directly on the skin. It's going to sting for a little while. If you can make it about a minute, it's going to feel a lot better because your skin is going to numb, right? All those little nociceptors are going to shut down and you won't be feeling that painful stimulus anymore. So if you can make it a minute, you can do it. But please let me know if you can't make it through. So that's what I always tell my patients before I touch the ice to them. And then treatment times, this is a hard one because it really depends. So it depends on the area that you're doing it on, what size the area is, how deep the tissues are, right? Whether the tendon is really superficial or really deep, that makes a big difference. It also depends on the patient and their tolerance for it. So in general, for something like a trigger finger, I'll typically recommend that they'll do about 2 to 3 minutes, right? And that should be plenty of time to get the ice treatment in. For something like lateral epicondylitis, maybe about 3 to 5. It really just depends on how quickly they numb and kind of what they're feeling there. It's a little bit deeper in that area, and a lot of people are more muscular here than they are in the hand. And then for something like Decker veins, that's a little bit different, right? Because I mentioned earlier, we've got that sensory branch of the radial nerve that can be really, really sensitive in that area. And so usually what I'll do for those patients is I'll get them nice and stretched out. I'll loosen all those tendons up, right? And then at the end of our treatment, we'll try to get through about 30 seconds of very gentle pressure ice massage. So that one is one where it really just depends on the patient. Some of them will tolerate it and some of them won't, and that's okay. You just want to listen to your patients and always respect them and respect their pain and what they're feeling with the ice massage. So the timing really depends. I educate my patients to let them know, wait until it goes numb, go about 30 seconds more, and don't exceed, obviously, definitely not 10 minutes, right? That's way too long, in my opinion. Don't exceed 10 minutes for sure. That's your max limit, but probably 3 to 5 for treatments, the elbow down to the fingertips is probably going to be sufficient. So personally, for me in my practice, I tend to use ice massage, this modality, at the end of my treatment. So I've already done all of my manual treatment on them. I've done stretching. I've had them do their active stretches. I've had them do any strengthening exercises that they need to do. And then ice massage is going to be that relief at the end. So it's helping to decrease their inflammation and decrease their pain at the end of the session. It should give them a little bit of temporary relief as they leave. They should be walking out of the clinic feeling pretty good at that point. So that's typically how I tend to use it. But if you guys have other suggestions for how you've used ice massage successfully in the past, let me know. I'd love to hear about it. Yeah, so that's pretty much it, right? Not too difficult, not too complicated. Ice massage is a really good little modality, good little tool for you to be able to use and for you to use at home. Something that your patients can do for themselves really easily, and you can empower them to, kind of take ownership of their own treatment and helping them get better. Thank you guys so much for watching. I hope you enjoyed this video and found it helpful in some way. Please like this video if you enjoyed it. Subscribe if you want to follow the channel and Forward Therapy and get more hand therapy content in the future. I hope you guys have a great rest of your day, and thank you so much for watching. See you next time.